Right now, we have a lot of patients that come into clinic with memory symptoms, and it's often not immediately clear what the cause is. Often the cause is multifactorial. In other words, they have a lot of stress, maybe some anxiety, maybe they're taking some medications that are causing problems, maybe they have obstructive sleep apnea. And so it can take a little while to work through all of that, to do blood tests, to do brain imaging, and then to consider whether we think it's Alzheimer's disease as the cause or something else. And this is particularly when the symptoms are mild. And really that's when a lot of people are coming in now, is when people are still quite mildly affected. In some cases, I would say maybe 5%, we do Alzheimer's disease biomarkers. And that's typically when we or the patient really wants to know whether they have Alzheimer's disease for a variety of reasons. For example, maybe they are considering retiring if they have Alzheimer's disease. Maybe they just really want to know. Maybe their parent had it, and knowing whether or not they had it is something that they're have been concerned about for a prolonged period. So, and then also sometimes we have patients where it affects their ability to get disability benefits. So a lot of disability benefits are denied the first round. But if you have an objective test showing that it's not just stress, they have Alzheimer's disease, then they're much more likely to be accepted for benefits. So there's a whole variety of reasons we do testing. Also, sometimes we're considering other more malignant causes of dementia. So anyway, so we do those testing, the testing in rare cases right now. But if we had a blood test, I think we would do it much more often. We don't do biomarker testing now because the amyloid PET scan is very expensive. It's about $5,500 out of pocket, and most patients just can't afford that. And we don't do CSF biomarker testing right now because it's also expensive. It's usually paid for by insurance, but there's a copay. And then a lot of patients just don't like to undergo a spinal tap unless it's really necessary. But I think that if we had a blood test, the risks and benefit equation would be different. So I think we would order it on most of our patients because I think that it would probably be less expensive than an amyloid PET scan, and certainly people would feel much more comfortable with it than undergoing an LP. And so I think we would do it quite often. And then I think that could be helpful, back to your original question, in terms of early diagnosis, because right now, often what we do is we have this prolonged kind of workup period while we're trying to figure out the diagnosis, especially in these mild cases. We call it cognitive monitoring. And so it can take us a little while to decide that the patient probably has Alzheimer's disease as the cause of their symptoms, and not something else. And so really their diagnosis can be delayed. But if we had a blood test right away, I think that would help us. Another question though is, so if you find out you have Alzheimer's disease, or what are you going to do different? We don't have a drug right now to treat it. So I think I'm an optimist, but I think at some point we will have a drug that's effective. So that I think a blood test will be very important when that happens. And also I do think that when patients have a clear diagnosis, that helps them. That helps them kind of know what's going on with them and what to expect down the future. I think it can help their family also in terms of knowing what to expect. I think that patients often have difficulty with uncertainty of what's wrong with them. So I think there's definite advantages to having a clear diagnosis, and certainly biomarkers would help with that.